Greetings, everyone. The time for me shows 12 o'clock, so it is officially afternoon. I hope you all are doing well. I am Jocelyn Ross, and I'm the president with South Carolina Hands and Voices. And this is Topic Tuesday 2.0 that we do in collaboration with Beginnings SC, and we appreciate that partnership. We appreciate you joining for today's presentation where we're going to discuss specialized mental health services for deaf children and their families. And we have a pleasure of having Dara, Baril, and Jennifer Villar with us today. Dara is actually a former student at Gallaudet University, where she received her master's in school counseling and guidance, a wealth of experience over 15 years, and currently serves as Director of Deaf Services at the SC Department of Mental Health since 2017. She actually also serves on the board of Beginnings SC, so we appreciate her service with their agency, supporting parents of deaf and hard of hearing infants and children. Now, Dara was born deaf to hearing parents and actually has a younger deaf sister. And she enjoys watching March Madness basketball in her free time and football. Jennifer also graduated from Gallaudet and has a master's degree in school counseling and guidance and mental health emphasis. And she brings over 10 years of experience working with the deaf and hard of hearing community in both the school setting and mental health capacities. She used to do some previous school counselor work as a coordinator of deaf services in Baton Rouge, but now we have her here in South Carolina with the Department of Mental Health, and she supports families with children who are deaf and hard of hearing and adolescents statewide. Jennifer has a daughter who is a child of a deaf adult, Dakota, and in her free time, she just enjoys spending time with family and capturing special moments. So we definitely appreciate their time. We appreciate your time with joining us today. We're going to turn it over to Dara to start the presentation, but afterwards we'll allow people to come in as panelists and be able to ask questions via chat, or you can show your video and as information of Dara and Jennifer, our panelists on this, and we'll close out with some just final updates on next steps. But at the moment, I'll turn it over for our specialized mental health services for deaf children and their families, and I'll pass it to Dara. Thank you.
Hello, my name is Dara. This is my name sign. Thank you for inviting us to present today in your Topic Tuesday. I'm so thrilled to be here. And it's really nice to have such a wonderful partnership with Beginnings South Carolina and Hands to Voices of South Carolina. So I'm thrilled to be a part of this tonight. I want to explain to you about the Department of Mental Health and Deaf Services, so I'm going to share a screen with you here in a minute. We do provide services to individuals statewide, and so it's very important for us to know what services are available or resources are available. Within Deaf Services, we are often asked, why do you have a Deaf Services department? And really, it's the law. The law mandates us to have it. Under the Americans with Disabilities Act, they provide support to us so that we can provide services. The Rehabilitation Act of 1973, as amended, Title VI of the Civil Rights Act. These two laws provide support for us to be able to provide services to our deaf community. When a deaf person needs services, oftentimes they go to one of the centers or an office and there's hearing people there. So the support for them as a deaf person is not there. So it is a requirement for us to provide services to them. And it is effective in identifying the consumer's preferences of who they want to communicate with. They may prefer to meet with someone who is fluent in sign language. or someone who shares their native language. This is important when they come to us to receive services. Also, we specialize in working with deaf individuals to improve treatment outcomes. Treatment outcomes are there to show results of the services that we provide. Like I said, our program is statewide. We cover 16 counties across the state. We have access to 16 mental health centers within the Department of Mental Health and their inpatient facilities. We have some inpatient individuals and some outpatient individuals, and we provide services to them. So let's say, for instance, you go to Kingstree, South Carolina. In Kingstree, they have a mental health center there that can provide services for a deaf person. In Columbia, there's one there as well, and they can provide services there too. We have another one in Spartanburg, South Carolina, and they provide services there as well. We want to make sure that we're accessible all over the state of South Carolina. And we want to make it accessible for children, families, and let it be close to their home. Deaf Services works with patients who use American Sign Language or whose deafness has a direct impact on their mental health care. For example, they could be struggling to have a successful life. And so we need to have staff that can sign so that they can provide the support that they need and provide resources and tools to help them have a successful life and to be successful. They do some skill teaching. They help them prepare their life to be successful. Our program has some non-signing patients, and those are typically seen by the local mental health center staff, which is great. That's perfectly fine. Some of these individuals are CODAs, which are children of deaf adults, and they can sign, so we do service CODAs as well. All staff within Deaf Services are fluent in American Sign Language. Our DMH interpreters are trained in mental health interpreting. There is a program that specializes in mental health for interpreters, and they're part of that as well. Some services that we provide within the Deaf Services department is outpatient services for children, families, and adults using itinerant counselors who are part of regional teams located across the state. We have school-based services statewide, and Jennifer Villar, who is our other counselor, and she's the coordinator for school-based services. She's going to expound on that and let you know more information about that program. We have residential services in supported apartments and rent support at locations across the state. We have inpatient services at Patrick B. Harris Hospital and William S. Hall Psychiatric Institute. We also provide outpatient services there. One place is for adults and one place is for children. We also have statewide coordination services. For clinical services, which could be PSS, which is peer support services. We have also MHP, which is for mental health professionals. We have PRS, which is psychiatric rehabilitation services available, and we do the coordinating for all of those.
Hello, my name is Jennifer Villar. This is my name sign. And I'm the school mental health counselor with Deaf and Hard of Hearing Services through South Carolina's Department of Mental Health. I'm excited to share what we have to offer. School-based services have been a part of our program for many years, with various staff working in multiple students and families in different capacities. However, in 2017, a school-based position was established when I began working for Deaf Services. It has been almost 5 years now since the program started, and we're continuing to grow, and I'm very thankful for the opportunity to collaborate with Beginnings SC to spread the word. We have a multitude number of staff who work with children and families, as well as 2 primary school-based staff, myself and Tanya McDonald. Tanya serves a mix of deaf and hard of hearing children, while I primarily serve deaf children. At the screening, we determine the best fit based on communication method preferred. Even though the pandemic has been crazy, it's been beneficial because we are able to cross regions and provide services with the option of telehealth. We work with schools and families as well as other agencies as appropriate. Some families choose to opt for school-based services, and this is a great opportunity for clinicians, especially when behavioral issues or concerns are more noticeable in school than at home, because we have the chance to collaborate with school staff and work together on identifying ways to help the students strive academically and on a social emotional level as well. When issues are more noticeable at home, we typically encourage sessions to take place at home, so it does not remove this from their learning environment. Again, this is something that's determined based on each child's needs and family preference. We also have the ability to provide therapy through virtual platforms such as Zoom, DoxyMe, Videophone, and FaceTime. If families need an interpreter to communicate during family therapy or other services, we also assist in providing interpreters for that. We also have a psychiatrist who sees our children and their families for PMA. That's a psychiatric medical appointment. And the frequency of this appointment depends on the child's therapeutic needs. For children on Medicaid, they are required to be seen for an initial evaluation within 90 days of their case being open. Some families have expressed concern about medication, and I wanted to alleviate that fear. This does not automatically mean your child will be prescribed medication. The purpose of the initial appointment is for the psychiatrist to evaluate and determine if a diagnosis is appropriate, as well as make recommendations for any additional interventions if needed. Counseling themes range from A to Z. Some common themes are social skills, communication skills, relationships, family dynamics, family therapy and support, trauma-informed care, and coping skills. We have staff who are not school-based and also still work with students because of specific therapy approaches they are specialized in. We've noticed an increase in interest for trauma-informed care in the last few years, and I am rostered in TFCBT. It's Trauma-Focused Cognitive Behavioral Therapy. What's that, you might ask? It is an evidence-based treatment for children and adolescents that have been impacted by trauma. This is a unique therapy approach because it strongly encourages the involvement of the child's parents, caregiver, and the number of sessions can range between 12 and 18 sessions, depending on the severity of the trauma. It incorporates trauma-sensitive interventions, CBT interventions, and interventions as well as skills for the parent or caregiver to practice, utilizing with the child between sessions. This therapy addresses the specific emotional and mental health needs of children, adolescents, and their families as they navigate through the effects of trauma. When families or school staff ask how referrals can be made, It's really simple. They can either contact me via email, jennifer.villar@scdmh.org, or contact our Deaf Services referral line at deafservices@scdmh.org. We'll collect some basic information and inquire about communication method, then determine assigning of staff. A clinician will follow up and start the intake process and begin working with you. School staff are more than welcome to make referrals too. The only difference with that is that we will need parent permission to initiate services, and that usually gets done by the teacher asking prior to making the referral, and then the clinician will follow up with the parent to coordinate appointments. In some unique situations, we may work with the school staff to make the appointments happen. As I mentioned earlier, this program is continuing to grow and develop over time. We are looking forward to collaborating with more families and schools to spread awareness about what is available. Thank you.
Thank you, Jennifer. All right. As Jennifer explained, we have different options for school-based services. It can be in school or it can be at their home. We have telehealth appointments and a variety of platforms for our clients. We want to make sure that we meet the needs of our clients. Some of our favorite resources I have here to share with you guys is the Coping Skills Toolbox. This resource is to provide help with coping skills. So you can click on this site here. Also, we have the multitude of mental health and learning resources for children. And their website is there. Conversation starter prompt game. That's a way to initiate conversation within a group. Another one is 24 resources for children and teens with anxiety and their families. And there is a variety of tips in this website. Pinterest is a great resource. Jennifer mentioned that. It is a great place to find resources for mental health and coping skills with children. It starts discussion on emotions and identity by coloring, drawing, making collages. Oh, there's just a variety of ideas that Pinterest has. We will share more information with you after this webinar. Here is our logo, and it displays our support to children and families. We have two options or ways to contact us. We have our Deaf Services hotline. So if you have a crisis or need help, or if you just need someone to talk to, you can call our hotline at 803-339-3339. And this is available 24 hours a day, 7 days a week. Doesn't matter what time it's available. You can also call this number and leave a message, and a clinician on call will call you back. And then you can discuss what your needs are with them. And this same phone line provides a way to establish services, so you'll be able to talk to someone about that. It's the same phone number. You can also email Deaf Services at deafservices@scdmh.org. And this is another way to contact us for services. We have a wonderful team. Our team created some training in EMDR, which is eye movement desensitization and reprocessing therapy. This is evidence-based training that is available when using our services. We work hard to meet the needs of our clients and their families. So sometimes, families have struggles with depression, anxiety, and so we provide support services for them as well. And also we specialize in children's services because that's very important, because there are not very many agencies or even staff within an agency that can work with children. So I'm definitely thrilled to share those available resources to you. If you would like to contact Jennifer Villar, her email address is jennifer.villar@scdmh.org. If you have any program needs, you can contact me, Dara, Dara.Baril, Baril @scdmh.org. This Saturday, we will be at an event to support families and children, and we look forward to seeing y'all there.
Thank you so much, Dara, for your presentation and that video presentation from Jennifer. We're going to take 1 second. I think Jennifer with beginnings is going to switch all the attendees over to panelists. So you guys get your questions ready. And we're going to let 1 second go by, and then we'll all be in panelists where you can put your questions in chat or connect via video and ask your question of Dara. But this was a lot of great information, and I definitely like the slide with the favorite resources, including the conversation starter prompt game. My daughter, she's deaf, she wears bilateral cochlear implants, and we do table talks because I find that her language is behind her peer group.
Yes.
So we always like the little prompts and different games that help start those conversations so she can feel more integrated with her peers. So that's great information.
Yes.
So thank you.
Absolutely. You are welcome. It's so important that we share the resources that we have, because that's how we learn and we find information and some really cool things too. So there's so much out there on the internet for us to use.
Absolutely. And our kiddos need the practice too. It's something that they just practice at to get better and feel more comfortable.
It's important to practice those skills at home because they can apply to the real world in those situations, whether it be school-based settings or even church settings. So it's very important.
Dara, this is Lisa. You mentioned that you all are going to be somewhere this Saturday. I don't want to assume anything. So can you give us a little bit more information about where you guys are going to be and how families might kind of find you?
All right, sure. We'll be in Greer, South Carolina this weekend. The South Carolina Association of the Deaf is hosting an event for children and their families. And this is an opportunity for families to meet other deaf children. So we will have a booth there, and that will provide opportunities for families to meet families and to share the resources that we have. I don't know the exact location, but I can share that information when we're done.
That'd be great. I saw that on Facebook and shared it through some other channels that I have. But I'm very excited that you all are going to be there, because one of the things that I noticed was
Yes.
it's inclusive to all communication modalities, which is awesome, because that way who are on this journey and are discovering so much about all this newness when
Mm-hmm.
they're hearing parents like
Mm-hmm.
myself, because I'm also the parent of a young man now who's deaf. And anyway, I just remember it being overwhelming. And one of the best parts of that journey early on was really meeting adults who are successfully navigating the
Yes.
world
Mm-hmm.
and had a hearing loss. So for me, that was extremely impactful in a very positive way. So I love that you guys are going to be there. I wish that I could be there this weekend myself, actually, but because I love a lake.
Mm-hmm.
And we have, I think, probably the information, Dara, and so we can share that to at the end of the presentation, definitely.
Yes. Sure. It is important for families to meet other deaf adults, and especially if they have a successful life. I mean, from my experience growing up, I was an oral deaf person. I learned how to sign when I was 28 years old. So it is very important to meet folks who are just like you and they can understand what you're going through. Some similar backgrounds, because it's not very often that we meet people. Um, and so whenever we isolate ourselves, we're not able to grow. But whenever we don't and we meet other deaf people or things like that, we are able to become successful and to grow as a person. I mean, things are so different now than 20 years ago. And it's very important that you get out there.
Just so you all know, the link has been put in the chat to the SCAD's Family Day. It's Saturday in Greer. So that's awesome. Are there any more questions for Dara? Okay, well, we appreciate everyone for being there. Please spread the word, and be reminded that these presentations are always recorded. So if there's something that you need to reference back, you can. If you know others who may benefit this, because their services help young adults to adults. So definitely resources that are there for them to support families. Um, and just a couple of updates from Hands and Voices. We have an upcoming virtual ladies' night mingle on next Tuesday. So check our website for that link and sign up. We talk about self-care and mindset is everything on this topic for Tuesday. And we do a little pamper kit and mail them out. So those will be going out Thursday. So register for that. If you're in or near the Florence area, we'll be having a family mingle at a park in Florence on next Saturday, April 30th. And then May, 2 weeks later, right after Mother's Day weekend, we'll be at the Greenville Zoo. So we have some upcoming mingles scheduled all the way out to July, which will be in Myrtle Beach. I'm pleased to say that the Wind Down event for Beginnings SC has completely sold out, but I hope you have those tickets to attend and we'll be able to see you guys there. And to always connect to us, either organization on Facebook or our website for information. And even if you just have ideas on upcoming topics, if there's something that you want to know about this Department of Mental Health resource is huge in South Carolina, and we appreciate everything they do. If you have topics and want more information or to see the archives, please know that information is there, and we're always here to assist you. Our next topic Tuesday will be on the evening time because, we alternate to try to be flexible with people and their schedules. So that will be the evening time at 7 p.m. And that will be a recap of all of our presentations that we've had in the fall for our May. And then we pause a little bit for summer so everyone can enjoy and reconvene back later. But thank you guys so much. Thank you to our presenters. Thank you, Sean, for interpreting for us. And we always appreciate connecting with everyone. Thank you so much.
Great. Thank you.